What's going on, guys, and welcome back to the podcast, the world's okayest physical therapist podcast. I'm your host, Dr. Andrew Hinton, and I'm going to be talking about one of the most common questions that I get asked on a daily basis almost by people who don't know the difference between a physical therapist and a personal trainer. And the question is, what is the difference between a physical therapist and a personal trainer? And this is usually asked by people for a multitude of reasons. One of those reasons is because physical therapists and personal trainers both like to use the acronym PT after our names to denote our profession. Physical therapists have gotten a little bit better at this, and now we write DPT because over the last 20 years, physical therapy has gone from being a bachelor's degree to becoming a doctorate level degree, meaning you have to have a doctorate of physical therapy in order to graduate and become a new physical therapist. The old physical therapists, where it was a bachelor's degree, they're grafted in. Personal training, by comparison, is a certificate that says that you are either a certified personal trainer or a strength and conditioning coach or a host of other options. So the chief difference between the two, to begin, is difference in purpose. A personal trainer is meant to help you obtain fitness goals, meaning you come into a meeting with one of them and you say, "Hi, I want to get bigger and stronger in my arms, my biceps and triceps," or "I want to increase my deadlift weight." Whatever it is, I want to reduce the amount of body mass that I have. I want to reduce body fat and be slimmer. And a personal trainer is going to mark down all these things, take your body weight, have an understanding of a little bit of your medical history, and then they're going to create a personalized fitness program, which is going to be just for you. It might have similarities with other programs that they've written, but it's going to be just for you that they're going to be working on. Now, some strengths here already is that it is individualized for the most part. Now, I know a lot of personal trainers work from home now. A lot of them do over the internet. They do virtual meetings, telehealth, all those sorts of things. A lot of times you'll see those ads on Instagram where it says, single dads or stay-at-home dads in the ages of 20 and 30 are needed. I need 8 of them. You'll see like some sort of meme where it says 8 dads aged 30 to whatever are needed to undergo a grueling 35-day workout program, blah, 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 blah. It's all a marketing strategy. All it is a bunch of personal trainers looking for new clients, and they're trying to find the most highly motivated people in order to help them improve. Why? Well, the most highly motivated people out there are the ones that are going to tend to be the most successful, right? So a personal trainer is looking for people that they can help give their insight, their knowledge, their understanding, and their education to help them achieve their fitness goals. Now, it's important here that we, again, discuss fitness. Now, fitness is predicated on the idea that you're not doing this for a rehabilitation goal. You're not doing this in order to recover from surgery, for example, or anything like that. Personal trainers are not given the same level of education as physical therapists, right? It's a certificate which may be backed by 4 years of college education. But at the bare bones, you're looking at someone who has graduated high school and has a certificate. They may or may not have college education, and they may or may not do this on the side in addition to whatever else it is. I don't want you, dear listener, to think that I am trying to knock on personal trainers, because I am not. A lot of personal trainers are extremely knowledgeable in their craft. They know exactly what works and what the cutting edge science is to help people get to their desired outcome. And education through a college isn't necessarily the best avenue to help people as a personal trainer, right? A background in the military, a background in being a firefighter, a background in being a police officer, a background in being a ballerina, whatever that is, if you're a personal trainer that has gone through something in life that is a niche experience like that, soccer player, football player, whatever, you take a lot of that experience, and whatever it is that those coaches that trained you, you get to take all of that information forward with you and help better it, help improve it, and help better tailor it for your patients or your clients in this case. But at the bare minimum, what you're dealing with is someone that graduated from high school, most likely, and has the certificate, right, that says that they can personally train you. And again, for your fitness goals, one of the things that's factored into that is this idea of periodization, where they're not just making you one exercise at a time. They're not making you, a plan of just one exercise at a time or one day at a time. They're planning usually on a monthly basis, if not longer. They're usually thinking 4 to 8 weeks out of how they want to get you to a specific goal of lifting a specific amount of weight, and they're trying to provide the correct dosage to your body to help you get there. So, personal trainer is looking to help you meet your fitness goals, and they're thinking long term, like weeks out, of helping you get there if that's your goal. There's other types of coaches out there, right? There's running coaches, like I said, strength and conditioning coaches. All of these are just different specializations that focus on one niche topic, like running coach. Okay, you want to get into running? Here's how we're going to dose you into running. Here's the exercises you need to do when you're running in order to make sure you keep your quads, your glutes, your hamstrings, your ankles strong to prevent injury. Or here's the distance that I know you want to run, so here's going to program for that. All of this falls under personal training. Physical therapy, by contrast, is designed to help you improve your active range of motion and your strength and your functional mobility in order to restore you to your previous level of function, and of course to reduce pain, right? That's the number one reason why everybody says they're going to physical therapists, is they hurt something. Now, physical therapy goes after your active range of motion, and it goes after your strength and functional mobility, just like I said. Active range of motion is how much you can move a joint. Strength is, of course, the strength in a specific motion, right? So shoulder flexion, shoulder abduction, shoulder external rotation, etc. Hip, whatever, trunk, doesn't matter. Physical therapists have to, as part of their assessment, go in and assess your base strength and a whole bunch of muscles surrounding the joint or joints of interest. So if you came in and said, my shoulder hurts, a good physical therapist, I will add that caveat, will look at the cervical spine, the shoulder, the thoracic spine, I've heard both ways, the lumbar spine, the elbow, and the wrist. They're going to look at the entire area surrounding that joint and see if there's anything that can be contributing to shoulder dysfunction. They're going to take active range of motion measurements in every direction that they can if they have the time, and they're also going to take strength measurements in a bunch of different directions. All of this is going to provide them information on what we call impairments. And that's really where physical therapy and personal training really start to divulge, is the depth at which a physical therapist is going to evaluate you, see where you have limitations, see where those impairments are, and it's usually compared left to right. And then we're going to use all those 3.5 years for most of us, not all of us, but 3.5 years of education and clinical experience that we had in our graduate level program to try to come up with a better picture of what's going on. We're going to try and determine if it's neurological, if it's musculoskeletal, if there's anything going on in the lymphatic system, if there's a significant amount of swelling where there shouldn't be. We're going to basically use our clinical reasoning to try to see what else could be going on, to have a series of hypotheses, and then we're going to come up with a plan of how to help you get back to your previous level of function. The most stereotypical, easy, straightforward example I can think of right now is if a patient comes in with shoulder weakness and decreased range of motion, active range of motion, I am going to strengthen them, and I'm going to use tools to make their range of motion better. Now, a physical therapist, again, is interested in restoring you to where you were before. So I'm not interested in helping you improve your deadlift. That's not my realm. That's not my space. If you come in and say, I need you to teach me how to do a deadlift, that is not a physical therapist's job. If you just come in and say, I need to do the perfect chin up, that is not a physical therapist's job. If you come in and you say, I need to do the perfect whatever movement, that is not a physical therapist's job. Our job is to restore you to what you were previously doing with reduced pain, improved strength, and improved range of motion. If you happened to have been deadlifting before you got hurt, and deadlifting is one of the things that is impaired, and then you come to me and say, I want to get back to deadlifting, or if you're in the Army, for example, and it's part of your PT test, and you need to get back to deadlifting, that now becomes part of my scope as a physical therapist. I am now interested in helping you improve your deadlift, but I'm not going to make you do a deadlift with perfect form every single time I see you. Instead, I'm going to be trying to break the deadlift down into its subsequent motions, it's the subsequent muscles that need to be strengthened, and the subsequent joints that need to have the improved range of motion. And I'm going to start from soup to nuts and build into a functional movement to give you the best possible outcome, the best possible chance of being able to do that deadlift pain free. That's a little bit different, right? That's a completely different starting point than a personal trainer where you walk in and say, I want to learn how to deadlift and I want to learn how to deadlift 400 pounds. That is you coming in and saying, I have this goal that I want to achieve that has nothing to do with pain and previous level of function. As a physical therapist, if you walk in and say, hey, I've been having really bad right hip pain and I'm a really active individual because I'm in the military and I need to be able to get back to deadlifting within the next 6 months because that's when I'm required to take my next PT test. Well, now as a physical therapist, you are tuned into, I have to get this person back to their previous level of function, which was deadlifting. Now, we broke down a little bit there what the physical therapist does, right? Active range of motion, strengthening, and then functional movement, helping you get back to doing that. So the question that most people are really asking is, who should I see, right? A lot of people aren't just saying, well, what's the difference between a personal trainer and a physical therapist? You're basically the same. They're really saying, who should I see and when? And the answer to that question is, if you're in pain, you have to go to a physical therapist. They're just going to be the most knowledgeable between the two of how to improve you. It's just what you need to do, right? At the physical therapy exists to improve your outcomes. A personal trainer is not going to be the one that is equipped to help you improve your pain. In fact, if you go to a personal trainer and say, hey, I have pain with all these things, they're probably going to say, we need to stop and you need to go talk to a medical professional like a physical therapist or a DO, a doctor of osteopathic medicine, in order to determine what's going on. That is the fundamental difference between the two, is where you're coming from, what your goals are, and if anything relates with reduced pain, probably, you are better off going to a physical therapist because that's the physical therapist's realm, is pain, improving active range of motion, and improving strength. Now, here's where it gets a little bit blurry, is what happens when you have a physical therapist who also has a strength and conditioning coach certification, which would be a personal training certificate, or a CPT, which is a certified personal trainer. Well, that physical therapist has now been armed with the knowledge of both. They have the 3.5 years of graduate level education, and they also have all the understanding of a personal trainer and one body and one person to help you improve your, again, active range of motion and strength in order to return to what you want to do. This sort of personal trainer with that certificate can also be a personal trainer on the side. But to give you guys a little bit of a clue of why a lot of personal trainers a lot of physical therapists don't like to really work as personal trainers, is because when you are being a personal trainer as a physical therapist, you have an advanced degree, you have an advanced certificate given to you by the state in which you're practicing. If anyone is injured or hurt while you are personally training them, they get to go after your highest level certification, which is no longer your personal training certificate. It is in fact your doctorate, which is and the right for you to practice in that state is what they can go after. That's why you see a lot of physical therapists that invested a lot of time, at least 7 years of their lives, getting that physical therapy degree, unwilling to do any personal training on the side, because it possibly puts your it puts your practice at risk, even more than as a physical therapist as you already are. And physical therapy is one of the few professions that is especially at risk of unhappy patients trying to sue you and say that you made them worse. Um, so that is one of those reasons why you don't see a lot of physical therapists rushing in to be personal trainers. That's why you see a lot of them instead taking to Instagram, YouTube, whatever, podcasts, and posting all of their knowledge there, and then providing looking for an audience that they can show cool exercises with that they do themselves. They're trying to get away from the possibility of any sort of litigation that could occur to them. Plus, physical therapists work, sometimes ridiculous hours, and the last thing that they want to do is spend their weekend hours personally training someone when they could actually go out and be living a little bit of their lives. That's another reason why physical therapists probably don't want to do it as much. But one last thing I want to add in there too is I'm remiss for not talking about this. The issuing body, who's giving these certificates out? Well, physical therapists, you have to pass your exam, your exam to get your license, right? And you also have to pass a state exam in order to be able to practice in the state in which you are at. So living in Delaware, for example, you would have to have you have to pass the Delaware test in order to practice in Delaware. And the minute you pick up and move to Maryland, for example, you would have to then take the Maryland exam, because a lot of states do not recognize each other's physical therapy certificates. And that's because there's lots of different laws. Some states allow physical therapists to do something called dry needling, and others don't. And anyway, that would be going more in the weeds. So that's a physical therapist. A personal trainer on the other side is going to be getting their certificate to practice from whatever body it is that they've chosen to take the exam. So let me check this real quick. The certified personal physical therapist comes from NASM, and then the CSCS certification comes from the NSCA. So that's just to give you the idea that there are two different organizations out there offering these recognized personal training certificates, opposed to just one for physical therapy. So this has been a very brief overview of the difference between physical therapy and personal training. Hope you guys enjoyed it. Please consider joining the Patreon if you haven't already. Keep an eye out for the app. I swear to you it's coming. We've resubmitted it 3 times now. Consider picking up a shirt while you're at it if you want to help support the show. The link will be in the Etsy in the description here. And everybody stay healthy, stay fit, and stay awesome. And I will catch you all in the next video.